Welcome to the Northwestern Medicine Weight Loss Surgery Program. We are committed to providing you with the education you need for long-term success after weight loss surgery. This program is made up of 2 modules. Part 1 will explain the Northwestern Medicine program overview and treatment options. Part 2 will give you information about how the Northwestern Medicine program works. Let's begin. This first module will provide information about the Northwestern Medicine Weight Loss Surgery Program and the team that will be caring for you, how obesity affects you, and what we can do to treat it. We will also talk about the types of weight loss surgery that may be available to you. If you suffer from severe obesity and cannot lose weight with a healthy diet and exercise, weight loss surgery, also known as bariatric surgery, might be right for you. This module will help you decide if weight loss surgery and the Northwestern Medicine Bariatric Program can help you take big steps toward making a permanent lifestyle change. We are committed to providing the highest level of patient care every step of the way. We are here to help you reach your goal of healthy, long-lasting weight loss. You can choose where you decide to have your surgery. At Northwestern Medicine, we are certified by the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. This means that our program meets the standards for the best care for patients undergoing bariatric surgery. Some of these standards include performing a certain number of surgeries. We meet this standard by doing a large number of bariatric surgeries. We also meet the standards for quality and safety in the way we care for our patients. Insurance companies provide better coverage for hospitals that are designated Centers for Excellence. We have received approval from Blue Cross Blue Shield, Cigna, and Aetna insurance carriers. Our insurance specialists can help you with this information. It takes more than you and your physician to achieve weight loss success. Our bariatric surgery team includes many dedicated healthcare providers to meet the many different needs of our patients. The team will work with you throughout your weight loss journey. Our center has a dedicated team of board-certified bariatric surgeons with more than 10 years of bariatric surgery experience. Our other specialists include nurse practitioners and physician assistants, obesity medicine specialists, dietitians, and health psychologists who have experience meeting the unique needs of our patients on their journey to weight loss. We also refer to other specialists at Northwestern Medicine based on the needs of each patient. Weight loss surgery can be an effective weight loss solution for patients who are severely obese and who have tried to lose weight but have not been successful in the past. During weight loss surgery, the physicians operate on the stomach to make it smaller. We have done more than 5,000 bariatric surgeries since the beginning of the program in 1999. That's about 250 operations a year. We offer a variety of surgical weight loss procedures, and our goal is to offer the least invasive options. The majority of the surgeries we perform are laparoscopic, avoiding the need for one large incision in the belly. Laparoscopic surgery is done by making 5 to 6 small incisions in the belly, using a camera and tiny instruments to complete the procedure. Laparoscopic surgery has benefits that may include a shorter hospital stay, easier recovery, and less pain. We will talk about the choices for the type of surgery a little later. Obesity is a health concern that is increasing worldwide. About 2/3 of adults in America are considered overweight or obese. We will now talk a little bit about how obesity affects your health and what we can do to treat it. What is obesity? Obesity is defined as having a body mass index, or BMI, greater than 30. Your BMI is calculated based on your height and weight. If you are obese, it's important for you to get treatment. Obesity can lead to a number of serious health conditions and illnesses. It affects your quality of life, being able to do things you may like to do. As a person's BMI increases, so do their chances of health concerns. Certain health concerns, like diabetes and high blood pressure, are made even worse by increased weight. Obesity can also affect how long you live. This is true no matter what your gender, race, or age is. Obesity affects just about every part of your body. It puts you at risk for a number of health concerns and illnesses. Some of the illnesses are listed here. Do you have any concerns that are on the list? Losing weight can help and sometimes get rid of some of these problems. If you are obese, it is important for you to get treatment to improve your health. Diet changes and an exercise program are usually the first steps. Medical treatments may include prescription medications to curb hunger or burn fat. Some patients have found success with treatments to change their eating habits. These treatments do not always work to help a person lose weight and keep the weight off. Taking off weight and keeping it off without surgery can be very difficult. If other treatments have failed to help you reach your weight loss goals, weight loss surgery might be an option for you. Compared to non-surgical treatment, studies show that those who have had weight loss surgery are more successful with long-term weight loss. Weight loss surgery may help patients who have failed other therapies. Overall, health improves and patients may live longer too, following weight loss. Weight loss surgery can be done as laparoscopic surgery, which means it is minimally invasive. The number of Americans choosing weight loss surgery as a way to lose weight and keep it off has been increasing. Those who want to have weight loss surgery must meet certain criteria to join the program. First, your BMI must be greater than 40 or greater than 35 with an illness related to obesity. You must show that you have tried other ways to lose weight but did not succeed. Your physician must evaluate you to make sure that you are not at high risk for complications from surgery. This means you do not have a severe disease that makes surgery too risky. If you are high risk, the team can look for ways to help you reduce your risk. One of the most important things to think about is the pledge to lose weight. You must commit to understanding and following the program. Our program details will be discussed in part 2 of this presentation. Weight loss behaviors, such as healthy eating and exercise, should start as soon as possible before surgery. We will now talk about the types of bariatric surgeries that are available at Northwestern Medicine. Weight loss or bariatric surgery is done to help severely obese patients who have tried to lose weight but have not been successful. During weight loss surgeries, the doctors operate on the stomach to make it smaller. This helps patients feel full more quickly so that they will eat less. We will talk about 2 types of weight loss surgery: Roux-en-Y gastric bypass and sleeve gastrectomy. You and your doctor will decide what type of surgery is right for you. Laparoscopic Roux-en-Y gastric bypass surgery was first performed about 20 years ago. This type of surgery has the most success for helping patients lose weight and keep it off. The top of the stomach is closed off to become the size of a small pouch. This limits the amount of food that can be eaten. The small intestine is connected to the new pouch, and the disconnected stomach and intestines are joined at a lower place. This lets important juices for digestion from the stomach, pancreas, and liver flow into the digestive system. Nothing is actually removed from your body. As with all surgeries, this surgery has benefits and risks. Roux-en-Y has the best success rate for long-term weight loss. It can also help improve diabetes. Roux-en-Y also has some risks. There is a very small chance that leaking can occur around the stitches used to connect the pieces of the stomach and intestines together. Fixing this would require another surgery. Another complication is when a narrowing of the intestines happens at the connection site. This is called a stricture. A stricture can be helped with an endoscopic dilation procedure. To do this, your surgeon would pass a tube down your throat and into the area to gently stretch and enlarge the opening. This is done while you are sedated. Another possible complication is an obstruction in the intestines caused by the rerouting. This is often fixed with another surgery. Also, your body may not be able to process vitamins and minerals as well as it did before surgery. This may lead to poor nutrition and other health concerns. Your physician can keep track of the levels of vitamins and minerals through regular blood tests after your surgery. This is one reason why eating a healthy diet, high in protein, and taking all of your recommended vitamins before and after surgery are important. Another type of weight loss surgery is called a sleeve gastrectomy. The operation removes part of the stomach. The stomach that is left is a narrow tube that limits the amount of food that can be eaten at one time. Less food means fewer calories, which means weight loss. Unlike Roux-en-Y, food can continue to pass through the intestines. Nothing is bypassed. Sleeve gastrectomy also has risks and benefits. Sleeve gastrectomy offers good long-term weight loss results, although patients who have had sleeve gastrectomy may not lose as much weight as those who have Roux-en-Y. Sleeve gastrectomy is generally a safer and faster procedure than Roux-en-Y gastric bypass. Let's look at some of the risks. Like Roux-en-Y, there is a chance of leaking around the incision. Also, this procedure may worsen or cause acid reflux disease or heartburn symptoms. Here you can look at a comparison of the two surgeries. Roux-en-Y is about a 2 to 3 hour surgery with a 2 to 3 day recovery time in the hospital. Sleeve gastrectomy is about a 1 to 2 hour surgery with a 1 to 2 day recovery time in the hospital. As you can see, each type of surgery has pros and cons that need to be considered when choosing a procedure that's right for you. Roux-en-Y has a higher risk of complications than sleeve gastrectomy, but you are also likely to lose more weight and keep the weight off following Roux-en-Y compared to sleeve gastrectomy. If you are ready to take the next steps towards weight loss through bariatric surgery, view Part 2 of this presentation, which explains the program process.